This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, August 5th, and I'm Zach Caruso. Our lead story this week is from JAMA and is titled Implementation Gaps in U.S. Syringe Service Programs 2022. This study performed a cross-sectional analysis of the Syringe Services Programs in the U.S. or SSPUS dataset to determine implementation gaps. 613 Syringe Service Programs, or SSPs, included in the dataset were geocoded to county boundaries, which were then analyzed for urbanicity and SSP need based on HCV mortality, HIV incidence, and drug overdose mortality. The study found that most high-needed counties did not have an SSP. 81% of the high HCV need counties, 69% of high HIV need counties, and 75% of high overdose need counties did not have an SSP. SSP were more commonly located in urban counties than suburban or rural counties. The study is limited in that not all SSPs are represented within the SSPUS database. However, it highlights important implementation gaps. Next is an article in International Journal of Drug Policy titled Modeling the Impact of Changing Drug Markets and Structural Determinants on HCV and/or HIV Transmission Among People Who Inject Drugs in the United States, a Rural and Urban Comparison. This study created an HCV and HIV transmission model calibrated to urban and rural area data. Fentanyl use was assumed to increase mortality and injection-related risk of HCV and HIV. HCV and HIV incidents were predicted using recent trends in fentanyl use, transition from injecting to smoking drugs, opiate agonist treatment, and incarceration in the model compared to no trend changes. The model suggests that fentanyl use contributed to 18% of new HCV infections in central/northern Wisconsin and 34% of new HCV infections in San Diego, as well as 10% of new HIV infections in San Diego. The increased transmission risk from fentanyl use was partially mitigated by a shift from injecting to smoking drugs, increases in opioid agonist treatment, and reductions in incarceration. Overall, fentanyl increased HCV in both urban and rural areas, highlighting the need for harm reduction initiatives. Next is a study in the Journal of Addiction Medicine titled Quetiapine, a novel additive to the illicit heroin supply in Los Angeles. Data from a drug checking service in Los Angeles showed that of 178 opioid samples, 52 contained heroin and 157 contained fentanyl. In addition, 25% of the 52 heroin samples also contained quetiapine. None of the heroin-negative samples contained quetiapine. Of the quetiapine-positive heroin samples, 31% also contained fentanyl, whereas of the quetiapine-negative samples, 69% contained fentanyl. Clients believed the samples containing quetiapine were black tar heroin and were unaware they contained quetiapine. 2 clients reported increased euphoria from the quetiapine samples, and 1 reported a pins and needles sensation. A drug checking service in North Carolina found quetiapine in samples from California, Michigan, Wisconsin, and North Carolina, indicating this may be a national trend. Our next article is in JAMA Pediatrics and is titled Prenatal Cannabis Use and Neonatal Outcomes, a Systematic Review and Meta-Analysis. This updated systematic review and meta-analysis of 51 studies explored if cannabis use in pregnancy is associated with neonatal outcomes. Prenatal cannabis use was associated with increased odds of preterm birth, small for gestational age, low birth weight, and perinatal mortality. Using cannabis in pregnancy was associated with increased risk of adverse neonatal outcomes. Healthcare professionals should include this in their patient counseling, and increased public health measures are needed to raise awareness on safety of use. Next is a study in the Substance Use and Addiction Journal titled From Homelessness to Safety, Short-Term Outcomes of Low-Threshold Shelter on Individuals Experiencing Substance Use Disorder and Unsheltered Homelessness. Over 2/3 of homeless individuals in the United States have an SUD. Early in the COVID pandemic, an encampment of homeless individuals developed in Boston. In response, the Boston Public Health Commission, city and state, established low-threshold shelters, or LTS. These LTS utilize a harm reduction approach and, unlike traditional shelters, do not require abstinence or SUD treatment. 50 residents of LTS were surveyed and reported significant improvements in quality of life, including personal hygiene, access to food, sleep quality, and security of belongings. Over 2/3 reported increased access to mental health and healthcare providers. Concerning substance use, 45% were engaged in SUD treatment, 71% reported decreased frequency of use, 86% were using MOUD, and 82% were confident an overdose would be reversed. LTS removed access barriers to people with homelessness and SUD and improved both quality of life and the SUD. Our final article is in the Lancet Psychiatry, August 2025, and is titled Priorities for Addressing Mental Health Conditions and Substance Use Disorders in Prisons in Sub-Saharan Africa, Expert Consensus from a Delphi Panel. People incarcerated in Africa are largely overlooked in global mental health research and guidelines. To address this gap, this study used the Delphi method, 4 rounds of surveys with 97 participants from 27 countries, to identify 38 key challenges in sub-Saharan African prisons. These span 10 themes, including care pathways, workforce shortages, gender-specific needs, acute conditions, policy reform, infrastructure, and re-entry support. These priorities offer a roadmap for improving mental health and substance use treatment and underscore the need for investment in healthcare and alternatives to incarceration. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.